Good morning, everyone. Brand new edition of Sports Medicine Weekly on this Saturday morning. So happy you are with us. Steve Cashel and Dr. Brian Cole. Dr. Cole, of course, the head team physician with the Chicago Bulls, one of the team physicians with the Chicago White Sox, sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. Our website is sportsmedicineweekly.com. And Dr. Cole, you ready to go? Another Saturday morning full of fun?
I am. It's
good.
Great to be here, Steve.
Well, we always have to talk about injuries, which aren't a lot of fun, but let's start in the NFL this week. New York Jets linebacker C.J. Mosley out with a severe groin abdominal injury. He says he'll know in the next week or two if he needs season-ending surgery. Okay, he's a four-time Pro Bowl selection with the Baltimore Ravens, suffered the injury in Week 1, then aggravated with his Week 7 return. So, of course, now plays with the Jets. But let's talk a little bit about this. He's wondering, boy, how far can I go before they need to cut me open, right?
Yeah, so, we don't know exactly the diagnosis, but I can take an educated guess. They're calling it a severe groin or abdominal injury, Steve.
Yep.
And those are often what we call, now there's a new category, we call them core muscle injuries. And you may have heard the term sports hernia. We've had several of them in the NBA. We've had several guys on our team over the years that we've had to have surgery. It's basically a soft tissue injury in the groin. It can involve the adductor muscle, the muscle that sort of inserts really high up in the groin, and or the whole complex that's sort of in the rectus or one of the abdominal muscles. It's a little bit complicated as far as the anatomy goes, but because it involves many structures, we call it a core muscle injury. So I'm going to bet that's what it is. And if an individual doesn't have pain and they actually had this injury, we would let them play. So it's all about pain. And especially in the NFL, it's not a terribly long season, and these guys have a week to get better. And if someone does have surgery for this type of injury, you're typically out, between 6 and 8, 10 weeks. So it's a good operation if you need it, but you're done. It's a season-ending injury it's a season-ending surgery. So in this case, he had a PRP injection, that's platelet-rich plasma, and it's an effort to sort of put the body's healing process on overdrive. So PRP, or platelet-rich plasma, is where we draw blood. We've talked about this many times, and we spin it down in a centrifuge, and we get, because of the weight of platelets relative to the other things in blood, you sort of get a layering effect in a centrifuge. So we take, say, 15 cc's of blood, we spin it down for several minutes in a centrifuge, and things layer out based upon the speed of the spin.
You get the best of the blood.
Yeah, so you get, in this case, the best of it, which is platelets. And platelets have lots and lots of growth factors that can stimulate healing. So this is a way to sort of supercharge a healing response, and to, in a way, there's no downside in my opinion, and I think it's a good idea to give this a try because, look, we know that once you have surgery, you're out. So I think they gave him, he was saying I have a 50-50 chance. There's not a lot of data here. There's just no downside to trying because if it works, great. If it doesn't, you tried and you'd be in the same position anyway. So hopefully he'll get better with this. Our thoughts are with him and the team. This is a challenging injury, and I guess the flip side is if it doesn't work, it's awful for him, awful for the team, but this shouldn't be a career-ending injury, and it's very fixable.
If he has surgery, then what is the return to play timeline?
I've seen in the NBA as soon as 6 weeks.
Okay.
NFL could be the same thing, but I wouldn't want to bank on that. It depends on exactly what gets done. But I would say you should use the time frame between 6 and 12 weeks, depending on how an athlete has to sort of get back into his craft again.
Is it more a pain tolerance following the surgery, or is it need for repair?
Yeah, there is a repair that happens. So there's a healing time that is obligatory. So I would say that healing time is obligatory at least 6 weeks, and some would say 8 weeks. That's why science is so important in doing what we do, Steve, because people can have, when they have a surgery or something fixed, we know for some of our laboratory work that the body basically healthy body takes about 6 to 8 weeks to heal, right? At 12 weeks, we know that most healing is about 75% of our body's strength, if you will. By 16 weeks, as long as there's proper healing, most things that heal represent the normal strength of the tissue, if that makes sense. So we generally, when we're really dependent upon repair strength, we're never thinking before 12 to 16 weeks. But there are some things that can heal very quickly within 6 to 8 weeks. So our timelines generally range when we're repairing something between, say, 6 to 8 weeks all the way up to 16 weeks. But then you have the added challenge, you've got to get an athlete back to play, so they have to sort of re-athleticize, right? So when you're protecting something while it's healing, they're also deconditioning at the same time. So you have to strike a balance between getting them to be an athlete again after a surgical procedure and then also protecting the repair. So that's where there is a tremendous amount of science and decision-making that goes into our timelines of getting someone back.